Need advice? Download the free Hello Doctor app on any mobile phone and connect with our doctors right away for reliable personal advice. Go to hellodoctor.com and chat to a doctor anytime, anywhere for less than the cost of an apple a day. TB's danger lies not only in the permanent damage it can do to your body, but just how infectious it is. If not treated, an infectious person can affect 20 other people or more in a year. In 1994, one of those infected people was Thabo Mwale, who is a TB survivor today, albeit with just one lung. Thabo, welcome to the show.
Thanks for having me, Mike.
Tell me a bit about your journey with tuberculosis.
Okay. Firstly, I didn't realize that I had TB when I realized that I have signs and symptoms of tuberculosis, coughing for more than 2 weeks. And then I didn't have any more information about the tuberculosis. And then after they diagnosed me of tuberculosis, I also didn't get more knowledge about it. And then that led me to default from my medications. And then after that, I realized that my left lung has been destroyed by tuberculosis. So I'm surviving with one lung after that.
What are the other risk factors for getting tuberculosis?
The places where tuberculosis is very high, people are at high risk to get tuberculosis. And then the person who is HIV positive, they've got more chances to get also tuberculosis. So it's very important for those people to get tested for tuberculosis.
How was tuberculosis diagnosed?
They took some sputum and then they go to test. They send them to laboratory. So after the results came, they came like positive, which means they told me that I had TB and I had to take my TB medication.
How is tuberculosis treated? It's a long course, isn't it?
Yeah, it's a long course, but it's very important to complete your treatment. For 6 months, you'll be 100% cured. But you remember in 1994 when I had TB, I was supposed to take 17 tablets. So it was too much for me. I was overwhelmed by those tablets.
So what is the treatment today?
The treatment now is easy because now you are only taking 4 tablets. And then I think we are going to win. Maybe one of the good days we'll take one tablet.
Yeah, as we're doing with ARVs.
Yeah.
Tell me about DOTS, the Daily Observed Treatment Schedule.
From my foundation, we mainly do that in our community by supervising our TB patient and making sure that they take their TB medication on a daily basis. And then it is very, very important for them to take their medications on their daily basis. That can avoid them to default from their medications.
Did you experience any negative interaction from people when you told your community that I'm TB positive or that I have TB?
Yes, doctor. I lost many friends. Friends were very few. But I don't blame some of them because they didn't know about tuberculosis. Also myself, I didn't know about the tuberculosis. That's why I defaulted from my medication. So I think nowadays people are getting to know more about tuberculosis and they are supporting each other for the patient who are getting it.
Tell me a bit about your foundation. I mean, the Thabo Mwale TB Foundation. That's a great foundation. You're doing good work, but just tell us what the goal is, what the vision is.
To be cured from tuberculosis is like I have a second chance. So I established the foundation for tuberculosis to assist our government, also to make it sure that people they get more information, taking care of the community, educate them within the community, giving them some educational material, making sure that they understand what is TB.
Thank you. That's amazing work that you're doing. I really appreciate your insights. That was great. We're putting up a good fight against TB in South Africa. In fact, the highest level of TB research is being done right here at home to develop new TB drugs, diagnostics, and vaccines. But while we wait for that breakthrough, there are other simple things you can do to prevent the spread of TB. Firstly, get tested for TB if you have any symptoms, especially if you have a cough or if you're losing weight. Secondly, if you're HIV positive, regularly ask your clinic to check if you have TB. Thirdly, cover your mouth when you sneeze or cough. We should all do that anyway. And finally, if you have TB, take your medicines exactly as prescribed, as Thabo said. TB or not TB? That should be the question that this generation must answer to. Need advice? Download the free Hello Doctor app on any mobile phone and connect with our doctors right away for reliable personal advice. Go to hellodoctor.com and chat to a doctor anytime, anywhere for less than the cost of an apple a day.